Hello, this is Mohammed Khalid Abdulati. I am in Group 7 and I'm going to represent Affirmative Team for the topic question, which is: should traditional medicine and healers be formally integrated into genetic and genomic healthcare in Africa, or should modern genetic practices remain distinct to ensure scientific standards? Our introduction talking about traditional medicine, which is a term used to describe medicines from the earth's natural resources. Different names for traditional medicines exist in the different cultures of the world, such as India's Ayurvedic, Chinese traditional medicine, Arabic, Yunani, and Japanese Kambo. According to WHO, traditional medicine is the sum of the knowledge, skills, and the practices based on the theories, beliefs, and experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health and the prevention, diagnosis, improvement, or treatment of physical and mental illness. So, our opening statement is: more than 80% of the world's population in over 170 of WHO's 194 member states currently use some form of traditional medicine, such as herbal medicine, yoga, Ayurveda, acupuncture, and acupressure, and indigenous therapies. For many, traditional medicine is the first port of call, and practitioners of traditional medicine have played an important role in treating chronic illness. From what we have seen in other fields, excluding traditional medicine from genetic and genomic healthcare ignores the reality of healthcare access and cultural beliefs in Africa. Therefore, integration can bridge the gap between modern science and indigenous knowledge, leading to better health outcomes. Okay, so our constructive arguments. First, cultural acceptability and trust. Traditional healers are trusted within communities and can facilitate genetic counseling and awareness. Also, improved healthcare access. Many rural communities have limited access to modern healthcare. Integrating traditional healers expands reach. Potential for complementary knowledge. Traditional medicine often includes plant-based remedies with pharmacogenomics relevance. Collaboration can lead to novel discoveries. Global precedents: countries like China and India have successfully integrated traditional medicine into modern healthcare, demonstrating a feasible model. Okay, so the other team have a lot of points, and we're going to review these points. First point was lack of scientific validation and standardization. Our counter argument is: while traditional medicine often lacks scientific validation and standardized practices, integration doesn't mean uncritical acceptance. Collaborating with traditional healers can facilitate the documentation and scientific evaluation of traditional remedies, leading to standardized and evidence-based approaches. Also, everything needs a starting point, and we can now implement all scientific standards for traditional medicines. Second point was risk of misinformation and misdiagnosis, and our counter argument is: the risk of misinformation and misdiagnosis can be mitigated through education and training programs that equip traditional healers with accurate genetic and genomic information. Integrating them into a regulated healthcare framework allows for cross-referrals to medical professionals, ensuring accurate diagnosis and appropriate interventions. This is a crucial reason to integrate traditional medicine, as we must care for all patients' health and their right to an accurate diagnosis. Third point is potential conflicts between scientific and cultural approaches. Our counter argument: conflicts between scientific and cultural approaches can be addressed through culturally sensitive communities and community engagement collaborative models, where traditional healers work alongside healthcare professionals, can create a balanced approach that respects cultural beliefs while maintaining scientific Additionally, we need to address any potential conflict now instead of ignoring it due to fear of confrontation. The fourth point was promotion of stigma and discrimination, and our counter-argument for that, on the contrary, integrating traditional healers can help reduce the stigma and discrimination by leveraging their trusted status within communities. They can play a crucial role in normalizing discussions about genetic conditions and encouraging early interventions, thus reducing fear and stigma associated with genetic disorders. Also, implementing new approaches can be challenging, but with time and increased awareness, people can normalize and recognize their presence in daily life, helping to eliminate all stigmas. The fifth point was ethical and legal challenges in accountability, and our counter-argument for that, ethical and legal challenges can be managed through the development of regulatory frameworks that outline clear rules, responsibilities, and accountability measures for traditional healers. Licensing and certification systems can ensure that only qualified practitioners participate in genetic and genomic healthcare. Also considering all ethical issues related to genomic research, the presence of rules and ethical committees ensures compliance. Okay, sixth point was limited research on how compatible integration would be, and our counter-argument, while research on the compatibility of integration is limited, pilot programs and community-based participatory research can provide valuable insights. Implementing pilot studies in specific regions can help evaluate the feasibility, challenges, and best practices for integrating traditional healers into modern healthcare system. We can consider other countries' experience in the issue, such as traditional Chinese medicine in China, the Ministry of Ayush. In India, and the traditional Korean medicine in South Korea. And now with our closing statement, integrating traditional medicine and healers into genetic and genomic healthcare is not about replacing modern science, but about making it more inclusive, effective, and culturally responsive. And we have a call of action to policymakers and healthcare professionals must explore structured frameworks for collaboration, ensuring safe, ethical, and beneficial integration. Here is a part of our references, and we are waiting for your questions. Thank you.